Good afternoon, everybody. My name is Seamus Corry, Wellbeing Consultant, Mental Health Practitioner, and welcome to my podcast, Wellbeing with Seamus. I'm delighted to be able to introduce to you this afternoon Paul Vittles, who has wonderfully accepted my invitation to come on and join me this afternoon. Paul, tell me a little bit about yourself. Who are you? Why are you on my podcast this afternoon?
Right. Yeah. Well, I grew up in the northeast of England and went to university in Bristol and went to work in London for Maury, the opinion pollsters. So I became a professional nosy parker. And then I worked for York City Council and I set up a consultancy which grew rapidly to 50 people.
Wow.
And I disappeared off to Australia for a complete lifestyle change. And some people might think, what's going on there? Well, I'll just fill in a few gaps there. I grew up in the northeast at a time when it was a tough time and jobs are being lost, factories are being closed, foundries are being closed, steelworks are being closed, shipyards are being closed, mines are being closed. And there's a lot of blokes had no job and no prospect of getting a job. And we lost a lot of those blokes to suicide at that time. So that touched me early on. And I went off to university partly to study economics and economic history to find out if there was any basis in economics, what the government was doing in my community in the northeast of England. And in 3 years study, I didn't find any basis in economics, what the government was doing to my community in the northeast of England. And my work, that probably shaped a lot of my work. It was about research, it was about community engagement, it was about partnership, it was about collaboration, it was about working together and creating communities and building strong communities to survive and thrive. And then that was going really well until 2003, as I say, growing the business to 50 people, and then I crashed. I hit the wall and crashed. So that was my first sort of big mental health crisis. And that's why I went to Australia for a complete lifestyle change.
Oh.
So there's a long story after that, but we should do this in bits, I think, Seamus.
Yeah, absolutely. I've read a little bit in terms of your background, Paul, and I've read your background in terms of your profile on LinkedIn, and I'm aware of the Join the Dots tour that's happening and the program that's been put together, which is how I first got in contact with you, Paul, because as a mental health practitioner and as a wellbeing consultant, suicide prevention is absolutely top of my list in terms of the work that I do to support and develop people to become mental health practitioners in their own right. So together we can, I suppose, work collectively to reduce the level of suicide in this country. Can you tell me a little bit about how the Join the Dots tour came into being and where that process started? And I suppose the second part of my question is, why now, Paul?
Yeah. Well, it's relevant to pick up that sort of thread from when I went to Australia, because that was my way of trying to change my own personal situation and sort of my own personal mental health issues at that time. And I'm quite comfortable now saying that I've lived with mental illness for the last 20 years. That's just my reality. Things went really well initially and it was going really well. And I got Australian citizenship, so I had dual Australian British citizenship, and I set up a business in January 2010. And was doing work in Australia and around the world and having a great time. And then my dad was diagnosed with cancer and my dad died and everything went pear-shaped after that. So I had another crisis after that. My son was diagnosed with a brain tumour and the NHS made a right hash of looking after his health, and his physical health was repaired, but they damaged his mental health in the way they handled that. So I went into a period where I was struggling. I was on medication, I was in therapy, and part of my way of coping with that was to get involved in suicide prevention. And I became actively involved with Suicide Prevention Australia. I used my professional skills in transformational change and community engagement and online engagement discussions and so on. And in 2013, it was the 60th anniversary of Samaritans, and it was the 50th anniversary of Lifeline in Australia, and I ran a global forum on breakthrough ideas for suicide prevention. So we came up with all these great ideas. I got to speak the next year at TEDx Sydney in front of 3,000 people at Sydney Opera House about some of this stuff. So that kind of launched a phase where I was working in mainstream suicide prevention, and then I got to a point where I thought, is this making any difference? I'm not sure. So I went around the world to look at the zero suicide community around the world to find out where they were getting the numbers down and how they were doing it. And that led me into all sorts of other areas. And when we came back to the UK in August 2019, because when I went out to Australia in 2005, we didn't have any grandchildren, and now we've got 5 granddaughters.
Congratulations. Fantastic.
So that brought us back. And I got involved with the Zero Suicide Alliance here in the UK. I worked with all sorts of organisations. And what I did was I drew from all the work I'd been doing over a long period, about 7 or 8 years worth of work, and built a transformation model. And then I met Steve Phillip at the Jordan Legacy, and we started working together. Steve had lost his son Jordan to suicide in December 2019. And in January 2023, Steve and I launched a big action research project. We met with Samaritans and Papyrus and the big charities, HS Mental Health Consultants, campaigners like the Three Dads Walking, people with lived experience of suicide. And we basically just kept asking people, what practical actions do you think will get the suicide numbers down? And through that process, we published a report, we had engagement, we got a second edition of the report, we challenged the government's national strategy as woeful in its low ambition, we presented an alternative. And that led to what we've now called the Zero Suicide Society Transformation Programme, which I now lead, or I'm Chief Facilitator. My official title is Chief Facilitator.
I love that. I love that title, Paul. I think
it's nice, isn't it?
Yeah, I like it. Yeah, I like it.
Yeah, I mean, it's partly tongue-in-cheek, because I'm not chief of anything really, but facilitator is really, really important. That's what we do, facilitate and collaborate. And this model that we built that will get the suicide numbers down towards zero, there's no place for competition. It's got to be collaborative. We work, we coordinate what's happening, and we join the dots. So we got this phrase, join the dots, connecting up the issues, the people, the organizations, the places, and getting everybody to work together. And we also have a philosophy which we call everyone must be a priority for someone, because the way the government approaches this and the way that the national strategists approach this is to identify priority groups that they think should be targeted for support. Well, of course, that means it's a competition you've just created where some people are priorities and some people are not, some people are winners, some people are losers, and you can't have losers in suicide prevention. Our philosophy is join everybody together, coordinate this. Everyone must be a priority for someone. And if someone is not a priority for someone, that's where we should go to fill the gaps. And we have missing pieces in our puzzle and things like that. And whenever we do an event, we have empty chairs on the stage and we remember all the people aren't with us and all the people can't be with us that day. So it's a process. It's a very structured process. It's rigorous. It's evidence-based. It's research-based. And we thought, let's roll this out. How do we roll this out and demonstrate it? And we chose a Join the Dots tour from the Humber to the Mersey in June, 11th to the 23rd of June. And it was designed to get to Liverpool by the 23rd of June, because on the 24th and 25th of June, it is the Global Zero Suicide Summit taking place this year in Liverpool. So taking place in the UK, taking place in Liverpool, people from all around the world, I think 50 plus countries, people are coming around, coming together to talk about how to get suicide numbers down around the world, what they're doing to get the numbers down, where it's working, etc. So we thought, let's get to Liverpool in time for that. So we started off with something, I think originally it was Leeds to Liverpool, then it became York to Liverpool, then it became Humber to Mersey. And so we've got this massive launch conference, a big tour right across the M62 corridor, and we get to Liverpool. Lots of events happening in Liverpool. It'll be a spectacular event. And the launch conference is going to be a spectacular event as well.
Wow, what a fabulous bit of work, Paul. And if my research is correct, I understand this is the first conference of its kind where everybody's coming together under one banner, under one roof, under one collaborative arm, as it were, to deal with this specific issue of suicide prevention and how, like you say, how do we all join the dots collectively to get suicide down to zero in our country?
It's different. The conference is going to be different in a number of ways. I've been to hundreds of suicide prevention conferences in the UK and Australia, around the world. And there's a pattern to them. They often are very top down. So you get a lot of policymakers there, professors there, politicians, and listening to lived experience is relatively new. Australia set up its first lived experience panel in 2014. And in the UK, I think it was about 4 years after that. I think about 2018, the first lived experience panels. This is relatively new, listening to and learning from people with lived experience of suicide and moving away from that professional model of the professors know best, or the clinicians know best, or the MPs know best. Well, they don't, because they haven't got a clue, because they can't get the numbers down.
No.
But people who've actually experienced suicide loss, suicide crisis, we're the ones that have the answers, right? So I used to joke at one point, I used to do this little joke with people when I spoke at conferences and say, so this is around about 2016, 2017, a typical suicide prevention conference, you get the doctors in white coats, usually men, male doctors in white coats come out to speak. Then you get the academics in tweed jackets. You get the politicians with two faces. And then you roll out the typical lived experience speaker. You get the token lived experience speaker comes out and you go, oh my God, a real person. Yeah.
Yeah.
So that's not like we don't want that. And you can't do that these days. So what we've got at our conference is more than half of the people on stage have lived experience of suicide.
Wow.
We took our model and we said, right, here are all the pieces in the puzzle, okay? So you've got healthcare, you've got workplaces, you've got education, schools, higher education, you've got designing out suicide, designing safer public environments, you've got tech for good initiatives, all these different things that we get involved in, people with long-term physical health problems who are at suicide risk, people who have experienced trauma who are at suicide risk. So they're all pieces in a puzzle. So for each piece, we drew up a list of the top professional expert in that area and the top lived experience spokesperson or campaigner in that area, and we invited them to this conference. So that was a unique approach. And then what happened was extraordinary, because when I organize conferences like this, I usually work on the assumption that when you send out the invites to people, you'll end up with maybe about a 60 to 65% acceptance rate, people who want to do it, people who are available, people who know where Scunthorpe is, that kind of thing. And we've got an unprecedented 90% acceptance rate, 90%. And so we have this massive kind of program of people. So we're different in that we're a ground-up movement where people with lived experience, over half of the people on the stage have lived experience, probably over half of the audience have lived experience. We're covering massive breadth of all the issues. Another characteristic of suicide prevention conferences historically is that it's all focused on healthcare. Everything is focused on healthcare. Suicide is treated as a health issue. It's treated as a mental health issue, but it's not. Those blokes that I lost in my community back in the early 1980s, we lost 15 blokes in our community to suicide. None of them had any history of mental health. They lost their jobs with no prospect of getting another job. They lost their identity. They started to lose all hope, and they had no support system around them. So it wasn't a mental health issue. So people get into suicide crisis because they lose a job, they lose their house, they have a relationship breakdown, they have gambling addiction, they lose access to their children. All sorts of things happen to people in life. They can't pay the bills, and it leads to suicide crisis. And they've never had any history of mental health, and it's not a health issue. So when I go to the Global Zero Suicide Summit on the 24th, 25th of June, I would imagine it'll be 2 days where I would reckon probably maybe 80% will be talking about healthcare and 20% will be talking about other stuff. Because it's mainly people working in healthcare that go to those global suicide summits. But at our conference, it will be, it'll be the other way around. It'll be 10% healthcare or 5% healthcare,
Good.
95% all the other stuff.
Yeah, and I've seen the program, and the program, Paul, is impressive. Two things about the program. Firstly, how you've been able to fit everybody in on a one day. And I know it starts at 9 a.m. in the Bath Hall in Scunthorpe, and I know it finishes at 5. But how you've managed to construct a program that, as you said, is from the bottom up. People will live the experience rather than the policymakers, rather than the politicians, rather than the healthcare professionals. There is a touch of that, but what I love about your conference, and the reason why I bought a ticket and I'm going to be there on the day with my Join the Thoughts tour shirt, which I've already purchased and linked to which will be on at the bottom of this video, is that it's got real people at it, sharing their real experience, their real understanding, whether it be Steve, whether it be other individuals within our community and within our country who have experienced, really powerful, awful experiences of loved ones who have taken their own lives. And you're absolutely right. I've got I've managed to print off the ONS figures for 2020, and it doesn't make for great reading. And I suppose the policies that are in place at the moment, the talky policies that are in place at the moment, with our outgoing government, they don't seem to be working.
No.
The numbers are substantially going up instead of going down. Yeah. So is it a kind of indirect consequence of having a major conference like this and a major expression and outpouring of support for suicide prevention, that do you hope then, with a general election looming, to be able to influence the incoming new government as it will present itself after the 4th of July to focus more clearly on support for your organization, what you're trying to achieve in ending suicide in this country?
Well, suicide is very complex, and
Yeah.
the world is very complex, and politics is very complex, but we can simplify it because it is actually a lot simpler than people make it out to be. I've worked in transformational change in my career for many, many years, and so I can actually look at the dynamics of suicide prevention and how that interacts with politics. And here's just a few of the things that come out of that analysis. And I've written a lot of this up, so I can give you links to
Okay.
I've written about this. So first of all, the suicide numbers were gradually coming down for years and years and years until 2007. Because what tended to happen is that professional people would get together and they would suggest things that might get the numbers down. So they tweak a bit here, a new policy there, a new bit of research leads to some change practices here. And so the numbers just kept coming down each year gradually, which was fine. Everybody thought there was not a problem here. And then that downward trend line stopped in 2007 and it flatlined for many years. And for the first few years, obviously, people didn't really do much about it. They're hoping that the numbers would start going down again, but they didn't go down. They kept staying at the same level. So we had this level of 6,000 plus preventable deaths by suicide every year since 2007. If you actually top that up, since 2007, that's a total of 100,000, more than 100,000 preventable deaths by suicide in this country since the year 2007 when the trend line changed. And then in recent years, the numbers have started going up. And in the past year in England, they've gone up by 6%.
Yeah.
So, this is a line that should be going down. And it's a line that's gone flat and then it started going up. So clearly something must be done. And it's taken that line to go up for the politicians and for the establishment to actually say, we've got a problem here. Now, they had a problem for 15 years, but they didn't treat it as a problem because the line was flat. So what they did is they spent a lot of their time spinning and trying to say that it wasn't a problem because at least the numbers weren't going up. They can't say that anymore because the numbers have gone up by 6% in the past year. So that's the first problem with the dynamics of it. There's inertia in the system. Then we've got low ambition. So in 2012, the first published suicide prevention strategy in England came in. And then they put a plan in place as required or as advised by the World Health Organization. And the World Health Organization said that your plan should have a target of at least 10% reduction in suicides in 5 years. And the government went for 10% in 5 years. So even though the World Health Organization said at least 10%, they went for the minimum of 10%. And they didn't achieve it because their ambition was not high. So even though they put that target in place, it starts with low ambition and it fails, basically. And then the new strategy came out last year and they didn't even have a target in it. They didn't bother to put a target in. They've just given up, basically. And the new strategy is just woeful. It's low ambition, it's shameful in spin, it's harmful in places. And I called it the suicide prevention strategy that prevents us from preventing suicides. So I didn't think very much of it. And I've written a 36,000 word critique of the national strategy if anybody really wants to go into detail about it. But in there, I also pointed out these dynamics. They create these competitions with priority groups. They launch suicide prevention grant funds that you can apply for to get some money, £10 million. And they trumpet this. The minister goes on TV and says, we've set aside £10 million and you can apply for it. Well, first of all, suicide, the latest report from the Samaritans and the London School of Economics shows that preventable suicides cost the economy £10 billion every year. So if you've got a problem that's costing the economy £10 billion each year, then £10 million in a grant fund ain't very much. It's scratching the surface. Then what happened is they had 1,800 applications for that grant fund. So what they did then is create another competition, and 79 organisations won that particular competition and got some money. 1,700 organisations got nothing. And they just got soul destroyed further by not having access to any funds. They also had the very strange thing where they gave out 25% of all of the money to 4 charities. which I find very bizarre. I can't understand how anybody can even think like that, that you've got a 10 million grant fund, you could potentially give £1,000 to hundreds of organisations out there trying to do good work, small charities, and you give a quarter of the money to 4 charities. It seems a bit strange to me. But so you've got low ambition, you've got a lack of understanding of the problem, you've got an outgoing government that clearly has given up, and then you've got a Labour Party, and I've met with my local Labour MP, and I've spoken with people in the Labour Party, and they don't even understand the problem that we're trying to solve here. So they'll say things like Keir Starmer says, we're going to try and get the suicide numbers down by tackling mental health waiting lists and tackling self-harm. And then you ask him a few more questions, and what happens is that you realise very quickly he doesn't really understand the problem. So what happens in reality is that, as I say, suicide is not just a mental health issue.
No, it's not.
So just tackling mental health services and waiting lists isn't going to help.
No.
Some people go into mental health services and psychiatric hospitals come out worse than when they went in, so that's not always the problem. Then you've got the fact that self-harm overlaps with suicide, but it's a different issue. Some people spend their lives self-harming, but not with suicidal intent. So, as I say, it's a complex problem that people, first of all, need to understand. Secondly, they need to understand the scale of this. As I say, there's 6,000 plus preventable deaths every year. Then they need to understand the practical solutions. And unfortunately, the professors who've been working in this for 30 years, the politicians, a lot of them don't understand enough about the practical solutions, and they don't have the commitment. So very little happens. Now, that sounds like a depressing picture, potentially, but what we've done in our report is outline what those practical actions are that will get the numbers down. The programme that we've built is ambitious. We believe that we can get the numbers down towards zero. We do things like saying, we say to all the professors and all the clinicians and all the politicians, do you believe, based on the research that's available, do you believe that most suicides are preventable? And they say, yes, absolutely. Research shows that most suicides are preventable. And we say, well, let's just do a little maths lesson here. Now, why would you set a target of 10% reduction if most suicides are preventable? Doesn't that mean that we can get at least 50% reduction in the number of suicides? And they go away scratching heads because they can't quite work out how they managed to paint themselves into that corner. But we show them these practical actions will get the numbers down.
Yeah.
And it comes back to collaboration. It comes back to working together, joining the dots, working with grassroots organisations that are doing incredible things. When we get to Liverpool, we'll go to Sean's Place on Friday evening. Sean's Place was set up by Debbie Rogers. She lost her brother Sean to suicide. Mental health services failed Sean. Local services generally failed Sean. Sean took his own life. Debbie said, I'm going to set up a centre for people like Sean. I'm going to set up the kind of centre that possibly could have kept my brother alive. Just a social centre, a meeting place, peer support, anything that will help these blokes who are struggling. And obviously I can't bring Sean back, but I'll help other blokes like Sean. So she got a room in a community hall, 6 chairs, blokes came in, how can I help? And she said, do you want clinical support? What kind of help do you need? And they said, can we go fishing? And she said, yeah, sure, we'll go fishing. We'll organise a fishing trip. And then a few weeks later, one of them said, I've always wanted to learn how to play the guitar. Right, we'll get some guitar lessons. And so it went on, just listening, acting. Last year, Sean's Place helped 3,000 blokes, 3,000 blokes. It is a world-class service in Liverpool. And that is one person just saying, we need to make a change here. We need to do something different. The government isn't helping. The NHS services are failing. They're doing the best, but they're failing. The money isn't coming in through statutory services. The waiting lists are getting longer and longer and longer. So what do? Do you keep trying to lobby your MP? Do you try and make it a general election issue? It doesn't tend to get you anywhere, apart from very frustrated. Or maybe you do something yourself. Maybe you actually just say, right, I'm going to open the centre, or I'm going to develop this app, or I'm going to bring a group of people together. And we're also in Liverpool. We're going to meet up with Alfie Fitzsimmons. Alfie lost his dad to suicide at the age of 8. And he had some counselling, but he wanted peer support. He really wanted to be with other kids his age who'd lost their dads to suicide or lost their parents to suicide, mainly dads. And so Alfie set up a charity at the age of 9 called Alfie's Squad. And he brought kids together who, like him, had lost their dads to suicide. Alfie's Squad now has 2 groups in Liverpool. It's spreading around the country. He's been on BBC Breakfast, on the Red Sofa. He's setting up Alfie's Squad online so that it's available for people all around the country. And he's going to be on stage at our festival in Merseyside. And so kids like Alfie are taking the action that our system can't take, that our politicians can't organise, that our statutory services can't cope with. And a lot of this good stuff that's bringing that's preventing the suicides and that's supporting people bereaved by suicide is happening in the community, creating safe, supportive spaces where people feel listened to and given the right kind of support and have instant access. Not being told. We have people who say they've been to their GP, they've told their GP that they're having thoughts of ending their life. They're put on a waiting list for NHS mental health treatment, and some of them are on waiting list for 3, 4, 5, 6 months. Did you not hear what I said? I said I was thinking of ending my life. I mean, it's crazy.
Today, Paul, thank you for sharing your incredible journey with me. Thank you for being so candid and honest in terms of your own mental health journey. I appreciate your transparency and your honesty in that. And I think as a mental health practitioner and as a wellbeing consultant, I too have had my mental health struggles. I too have contemplated suicide in the past, and thankfully I haven't, actioned that, and I'm still here today, gratefully to be able to tell the tale.
Yeah. And helping other people, as you do all the time.
Absolutely. So I am absolutely conscious of that. Here's finally, Paul, the pitch I want you to give. If there are tickets still available for Bath, and if there are tickets still available for your tour, what can people expect from the Join the Dots tour, starting in Bath and ending up in Liverpool? What can they expect along the way?
Well, first of all, it's starting at the Baths Hall, not in Bath. We're not going down south.
The Bath Hall, Doncaster Road in Scunthorpe.
It's Scunthorpe. We're starting at the Humber, near the Humber Bridge. And we've actually got somebody from the Humber Bridge board there. And so, we've got the launch conference on the 12th of June. And we're bringing together people who, as I say, can cover all these pieces of the puzzle. And we're covering issues there that have never been covered before at other conferences, or the other conferences shy away from. We've got Julia Waters, who is the sister of Ruth Perry. Ruth Perry, the head teacher who lost her life after the Ofsted inspection. Ofsted effectively killed Ruth Perry by giving her a death sentence that she took her own life 54 days into being told your school is going to be downgraded from outstanding to inadequate and you're not allowed to talk to anybody for 90 days. That was like giving somebody a death sentence, really. Now Ruth's sister, Julia, is going to be with us talking about her experience, talking about her sister, talking about Ofsted, talking about the government, talking about the unions, talking about teachers, and what everybody can do to stop other tragedies in the future. We've got people who are talking about other preventable tragedies. Most of these people can stand on the stage, tell you what happened to them, tell you what's happened to their loved ones, and what we can do to stop it happening to other people. And basically, it's a conference full of people doing that. We go to an event in York. We get to the Leeds Wakefield. There's a Cycle for Life ride. Steve lost his son Jordan to suicide in December 2019. Jordan used to live in Leeds. He used to work in Wakefield. Steve will be doing a cycle ride with anybody else who wants to join in on the 14th of June. Please, if you're into cycling, or even if you're not, we've got the Rugby League Cares Foundation supporting us. There'll be Rugby League internationals and people cycling around with us. It's a 34-mile circuit because Jordan was 34 when he died. And everybody will assemble at Wheatwood Hall in the Lawnswood Barn, and Jordan's funeral was at Lawnswood Cemetery. There's lots of joining the dots going on throughout this tour. Yeah. We go off to Bradford, we go to Halifax, Huddersfield. We have a Father's Day special. We bring together dads who lost someone to suicide, people who lost their dads to suicide, new dads who might be struggling being new dads. We bring them all together. We work with the Athletic Minds Foundation. We all go for a walk up Scandon Steps on the foot of the Pennines on the Yorkshire side. We go back to the Athletic Minds Foundation Wellness Centre and have lunch together and support each other. We go across the Pennines, we go to Rochdale and are greeted there by the Cabinet Member for Health and Wellbeing, and we go to Rochdale Mind and we meet people in Rochdale and Oldham, and we go to Bury. In Bury, we go to the Big Fandango, set up by Rebecca Jackson when she lost her 16-year-old daughter to suicide. Elspeth, she lost her daughter, Elspeth. Rebecca set up the Big Fandango. It's a craft workshop, community centre, training centre She helps kids with anxiety. She helps women with postnatal depression. She helps older people with chronic loneliness. They make stuff together. They bond. Rebecca pulled together the country's first ever Speak Their Name quilt, where people bereaved by suicide could make a square. They're all joined together. I think there's about 9 of them around the country now, 11 in production. She's also taken our Zero Suicide Society model and she's turned it into a quilt for us.
Wow.
So, and other garments, right? Literally joining the dots together there.
Literally joining the threads.
Yeah, absolutely. Yeah. It's extraordinary. I've seen it and it's extraordinary. She's going to bring it with us. They're going to be displayed at our launch conference.
Fantastic.
In the evening, we've got the Met Theatre. The council has donated to us, free of charge. It's given us the Met Theatre in Bury for an evening show. We go to Wigan. Ellie there is from Epic Hope, CIC. It's pulling together an extraordinary day of events in Wigan. We go to Warrington. The Warrington Wolves Stadium is being opened up for us for a couple of sessions there, working with the Rugby League. Case Foundation has also made some tour shirts for us as well. We get into Merseyside. We go to Sean's place. On the Saturday morning, we're being hosted at Anfield by the Liverpool FC Community Foundation, who've been tremendously supportive of everything we're trying to do. And they're going to be at our festival on the Sunday as well. On the Sunday morning, we have the Hope Gathering in Hope Street. And I coined this phrase when people say, "What business are you in, Paul?" I say, "I'm in the hope business," which gets a really interesting conversation going in the hope business. So we said, why don't we get everybody together who's in the hope business? So we'll have the Hope Gathering in Hope Street. We're going to have a Voices of Hope concert with reflections in the arts bar on Hope Street. We've got performers, bands, poets. We've got lived experience speakers. Then we walk down Hope Street to the Suitcases sculpture, which features in a video from a young performance poet called Joseph Roberts. So Joseph's going to be with us, and he's going to perform a poem about emotional baggage at the Suitcases sculpture, weather permitting. Samaritans are everywhere with us, and we're going to look after people there and have a great day in a safe, supportive environment. And tickets are available for all these events via the Jordan Legacy website, via our Eventbrite pages. And we get to the Bootle Festival, and big outdoor festival from 12 till 6 p.m. We're charging, we've said £20 minimum donation. Wow. For a festival like this, people would pay hundreds of pounds.
Absolutely.
And finish off, this is the big finish before I go off to the Global Zero Suicide Summit. We've got the Liverpool Lighthouse Community Choir.
Wow.
And they were recently on the BBC on Red Nose Day singing with Paloma Faith. They have in their choir members who lost loved ones at Hillsborough. They have Hillsborough survivors in there. They're a group of people who understand loss and trauma, and they understand what we're trying to do, and they wanted to close our festival. So we were very lucky to get them, but they're going to be there, and they're going to do various songs from their repertoire. And then I said to them, "Can you do a particular song to finish it?" I said, at our launch conference in Scunthorpe at the Baths Hall, we're finishing off with the Rumble Band, a 13-piece soul and Motown band, and asked them if they could give us what we regard as a suicide prevention anthem to finish off the conference. And it's the Sam and Dave classic, Hold On, I'm Coming. Wow. So that is the song that will finish our conference in Scunthorpe. So I said to the Liverpool Lighthouse Choir, I'd like to finish with a particular song. It's a song that you've sung hundreds of times, but it might be a bit different this time, because we'll have people in the audience here who have felt so alone that they wanted to end their lives, or they've lost loved ones in that situation. We'll have people who've lost all hope, and or have lost loved ones who lost all hope in their hearts. And so they're going to sing us out with "You'll Never Walk Alone with Hope in Your Heart."
Wow. Wow.
That will be the end of the festival and the culmination of our 2-week Join the Dots, Zero Suicide Society, Join the Dots tour.
Wow. Paul, I am honoured that you've taken the time out of your busy schedule and your busy day to come and speak to me this afternoon. I appreciate it. And I humbly thank you for taking the time out this afternoon. I really appreciate your time.
Well, I appreciate the opportunity, Seamus, and you are a very important person in my life because you bought a ticket. No,
I am, and I would encourage people this afternoon. I'm speaking right down the camera. If you've not bought a ticket for one of the most amazing, powerful conferences that you're ever likely to attend this year, buy a Join the Dots tour ticket. Join us in the Baths Hall in Scunthorpe on the 12th of June. Come on tour with us. Follow the path of the Humber to Merseyside over those 2 weeks. Message, social media, get the message out there. Are there tickets still available for the?
Yeah, there's tickets still available for the conference. We've actually got individual tickets at £120. Again, for the what's on offer, it's incredible value for money. But also, we found that quite a few people wanted a table, and they wanted to have a table that represented their place, their organisation, their theme, their issue. Like we've got a gambling-related suicides table, for example. So we started offering tables at £500 for up to 9 people. So it's like effectively a 50% discount. So a lot of people are looking at grabbing a table, and there's only a week to go, but there's still spaces, and you can buy an individual ticket online. And then for the other events along the way, there are still tickets available. And the festival, I mean, we don't know exactly how many people get there, but it's a very big space that we've got, an outdoor festival. And so, yeah, I mean, just please, anybody wants to be there, anybody who can get to Merseyside on Sunday, the 23rd, is in Merseyside or can get to Merseyside on Sunday, the 23rd of June, please get a ticket and come and join. And it will be a unique event. There'll be nothing, I'm not aware of anything like this before, and probably there won't be anything like this again, because it's been a unique set of circumstances, the launch of the new programme, the fact that it's the Global Zero Suicide Summit. A lot of those international delegates who are flying in for the Global Zero Suicide Summit are also going to come to our festival. And so it'll be a really good kind of gathering place for a lot of people who work in suicide prevention, as well as people with lived experience of suicide.
Fantastic. Paul Vittles, thank you so much. And I'm deeply appreciative to you this afternoon for taking the time out in your busy schedule to talk to me. I'm grateful to Suzanne Baines for putting us in contact with one another through the link on LinkedIn.
Yeah, and she's going to be performing as well. She's written a poem for us.
She has, and going out to Susie today, she's one heck of a woman, and I'm proud to wear her T-shirts when I'm delivering mental health training. You Matter Always is an amazing organisation, and she's doing amazing work in her own right in around Glasgow with support groups that she's facilitating at the moment. So you're in for a treat.
I couldn't believe it. She wrote a poem called "Join the Dots." I mean, and I feel honoured and privileged that people are doing these kinds of things as well.
100%. Paul, can I wish you well? Can I ask you to continue to join the dots? And I hope this is just the beginning, not the end of what will become a regular annual national, if not international event, as we all.
It won't be a replication of an event, but the program will continue in some form. I've been contacted by people from 18 different parts of the UK asking if we can do this kind of thing.
Absolutely.
And I've said to them, what do you want to do in your area? Don't try and replicate what I'm doing here. I mean, what do you want to do in your area, and how can I help you do that? But I've set up a new community interest company specifically to be 100% dedicated to rolling out the Zero Suicide Society Transformation Program. And the company is called TowardsZeroSuicide.
And I would again encourage everybody to check that company out, to check Paul out, to check the Join the Dots tour out, to check the 2-week festival out, to buy tickets, to buy shirts, to support this amazing initiative, to hopefully bring hearts and minds together so that collectively, in all the work that we do in various ways, we can end suicide in this.
And that's where the hope lies. That's where the hope lies at the end of the day. It's the hope that keeps us going. There's no better source of hope than knowing we can get these numbers down to 0.
We can, and you're right. If we all collectively and collaboratively work together, not talking the talk, but actually walking the walk, boots on the ground to make a difference in real people's lives, and people will get a real experience of that over the next 2 weeks as the tour starts on the 12th of June, by real people doing real things in real communities to end the blight of suicide in this country once and for all. And I wish you well, Paul, and I wish you well in terms of your organisation. I wish you and your partners well, and the Jordan Legacy well, in terms of getting the message clearly out there. Anything that I can do in my small, humble way to spread the message for you, I absolutely will do. This recording will be available on my YouTube channel, which will be available in the links, and I encourage people to listen again to this recording, as well as read the links that will accompany this podcast this afternoon. Paul, thank you ever so much for your time this afternoon.
Thank you, Seamus.